हेलो स्टूडेंट, ड्रग एक्टिंग ऑन सीएनएस सिस्टम, उसमें हमारा नेक्स्ट टॉपिक है एंटी डिप्रेसेंट ड्रग्स। So here are the few images which describes about how the state of depression affects the human body. So depression or our body mood we can say, or the normal routines are affected by mainly three neurotransmitter named as norepinephrine, serotonin and dopamine. Depressive symptoms like loss of sleep and poor concentration means we cope less and well, and things go wrong, which ultimately leads to the greater level of depression, depress, and negativity, with still worse physical symptoms, which leaves us less able to cope up and soon. So here are the uh, affective disorders such as episodal depression, seasonal affective disorders, atypical depressions. Then next is the major endogenous depressions, mania and bipolar depressions. Firstly, what is episodal or reactive depression? This include adverse life events, physical illness, drugs, other psychiatric disorders. Then next is the reactive or episodal depression. It includes more than 60% of all depressions, core depressive syndromes, feeling of misery, pity, inadequacy, permissive anxiety, tension, guilt, ugliness, low self-esteem, bodily complaint, withdrawal, loss of interest in pleasures, activity, indecisiveness, loss of motivation, retardation of thoughts and action, sleep disturbance. In severe cases, it is accompanied by hallucination and delusions, recurrent suicidal tendencies, a suicide attempt or a specific suicide plan, significant weight loss without dieting, psychomotor agitation, retardation. It also these person has a genetic component. Depression can be a drug induced depression, it can be a drug repressed, it can be depression can be treated with drugs, depression can be treated with electroconvulsion therapy, that is ECT. Next is the mania. Mania generally is a uh, rare condition in which only 10% and people are affected. Most frequently cycles with major and endogenous depression. Manic depression disease or bipolar disorder. The core symptoms include characterized by the elevated high mood, means aggressive mood, talkative, go on and on about the things they will do. Increased self-esteem, auditory hallucination, decreased need to sleep, uh, expressiveness, then lack of judgment and supreme. Next, it includes the precise cause of affective disorder remain elusive. Evidence implicates alternation in firing parents of subset of biogenic amines in CNS, non-epinephrine and serotonin, that is 5 HT, that is 5 hydroxytryptamine, decrease in the norepinephrine and 5-HT symptom. Almost all non-epinephrine pathway in the brain originate from the cell's body of the neural cells in the locus coeruleus in midbrain, which send their axon diffusively to the cortex, cerebellum, and limbs area. Hippocampus, amygdala, hypothalamus, thalamus. So if we summarize all different types: mood, higher function performed by cortex; cognitive function, function of cortex; drive and motivation, function of brainstem; some memory and emotion, function of hippocampus and amygdala; next, endocrine response, function of hypothalamus. Serotonin system. As with non-epinephrine system, serotonin neuron located in the pons and midbrain in group, also also called as raphe nuclei, send their projection diffusively to the cortex, hippocampus, amygdala, hypothalamus, thalamus, etc. Same area implicated in depression. This system is also involved in anxiety, sleep, sexual behavior, temperature regulation, CFS production, that is cerebral spinal fluid. Is the different locations of the brain. This picture depicts the different location of the brain. This picture also depicts the different location of the brain. So how the depression can be cured? Here are the firstly blocked by antidepressant. So depression, if we talk about depression in a casual language, it means depression means sadness or possibly intense. It is a usually of short duration, but if it will be a long lasting, or it will be a like more than a few days, then that means it is a illness or a disorder. It may be a symptoms of a primary active illness. The feeling of sadness and moodiness and are experienced periodically by almost every person. Symptoms of depressions include fatigue, headache, insomnia, GIT disturbance, anorexia, skeletal muscles complaint, loss of sexual desire, etc. However, severe depression in symptoms which disturb normal functioning occur in about 0.5% person. If this is left untreated, it can be lead to the suicide. The drugs which are used to elevate, means to increase the mood level, they are called as antidepressant drug. It was observed that reserpine, an alkaloid from the royal Fia serpentina, produced behavioral depression by depleting catecholamine neurotransmitters such as norepinephrine and serotonin in CNS. Later on, it was shown that monoamino oxidase, that is MAO inhibitors, pyronazide block reserpine-induced depression as it prevents from the metabolism of catecholamines and thus increase the amines level in the brain. Subsequently, it was found that imipramine, a diazepine derivatives, also inhibit the uptake of norepinephrine in the neuron. Thus, it prevents metabolism of norepinephrine and potentiates its effect and acts as an antidepressant drug. These observation leads to an amine hypothesis that depression is not all may be associated with the decreased functional amines, that is catecholamines, preferably non-epinephrine dependent transmissions. Modern era in the treatment of the depression began in the late 19th 1950s by introductions of MAO inhibitors and tricyclic antidepressant drugs. The first MAO inhibitor was ipronoside, which is an anti-tubercular drug which was found to possess mood elevating effect, but due to undesirable side effect, other hydrazine derivatives like phenelzine and non-hydrazine derivatives like cyclopramine are used. During the clinical study of neodiazepine derivatives, imipramine, the first tricyclic antidepressant was introduced. Later on, new antidepressants have been developed, such as imipramine. Amitriptyline is the normal healthy subject, do not elevate mood but produce feeling of unhappiness and increase anxiety. These drugs, these tricyclic antidepressants have slow onset of action and clinically effect may be apparent several weeks after starting therapy. They produce several side effects which may be due to anticholinergic action, for example, dry mouth, blurred vision, tachycardia, glaucoma, etc., or H1 receptor blocking action such as sedation. Serious side effects may occur when MAO inhibitors are administered with imipramine like antidepressant. Hence, it is recommended that change from tricyclic antidepressant to MAO inhibitors or vice versa should be done after 2 to 3 weeks. Now, next is the classification of antidepressant drugs. First class includes typical tricyclic antidepressant. These drugs include immunostilbins or diazepine derivatives. Example, imipramine. Next is the dibenzoazepine. Example, doxepine. Next is benzocycloheptanes and related compound. In this, example include amitriptyline, nortriptyline. Next class include MAO inhibitors, in which hydrazide or hydrazine derivatives are included, in which phenelzine is a compound. Non-hydrazide derivatives, this include cyclopropylamines. This includes proamines. Next is the sympathomimetic. These include dexamphetamine. Next is the atypical antidepressant. These are also termed as second generation of antidepressant. These include dibenzepine. Next is the miscellaneous beta adrenoreceptor antagonist. These drugs, the example of the drug contains salbutamol. Next is the thyrotropin releasing hormone. The typical tricyclic antidepressant possess different side effects such as anticholinergic actions, direct myocardial effect due to high affinity for cardiac tissue, that is cardiotonicity. Next is the sedation. However, typical antidepressants have quicker onset of action, but they reduce anticholinergic and cardiac toxicity and are less sedative. These are the different structures of antidepressant drug: amitriptyline, citalopram, clomipramine, desipramine, duloxetine, fluoxetine, imipramine, mirtazapine, nortriptyline, paroxetine, sertraline. These are the different antidepressant drugs. These are the different structures for the antidepressant drugs. So next are the discussion about drugs. The first drug include tricyclic antidepressant, in which imipramine is the drug. This is the structure of imipramine. Next is the chemistry. It contains 1H-azepine 7-membered ring which contain nitrogen at one position and 3 double bond. At B and F bond of azepine, 2 benzene rings are fused. The numbering of the fused ring system is different in which N atoms bear. In imipramine, nitrogen of the ring system is substituted by 3-dimethyl amino propyl radical. Thus, it contains 2 basic tertiary nitrogen atoms. Next is the physical property. It comes as hydrochloride salt, which is white, slightly yellowish crystalline powder. It is odorless and has bitter taste, followed by sensation of numbness. It is freely soluble in water. Chemical property: when it is treated with nitric acid, an intense blue color is produced. In the presence of water, oxygen, and light, it degrades to give dimethyl aminopropane and 10-hydroxy-aminodibenzyl. 10-hydroxy-aminodibenzyl undergo dehydration to give aminostilbene. This is followed by the contraction of central nervous system to give acridine and acridone derivative. This is a reaction. The formation of acridone and acridine. Next is the stability and storage. It is affected by moist air and light, hence it should be stored in tightly closed light resistance container. It is used to treat depressive illness. Example: chronic depression, dysrhythmia, anxiety disorder, anorexia, nervousness, pain. Next is, it is also used to treat phobia, hyperactivity, attention deficit, allergic conjunctivitis. These are the different pharmaceutical formulations such as tablet, capsule, injection, mixture. These are the brand names. Next drug include amitriptyline. This is the structure of amitriptyline. It is also a tricyclic antidepressant. In this, central ring is 7-membered, which does not contain heteroatoms. Means, in case of, if we look at the previous structure, there yes. If we look at the previous structure, there was an heteroatom, that is nitrogen was present. But in this case, here nitrogen was present. But in this case, no heteroatom is present. See, this is the structure of the imipramine. Here the nitrogen is present, and in case of the amitriptyline, nitrogen is not present. So this is a difference, basic difference. Physical property: it is officially come as hydrochloride salt, which is colorless or crystalline powder. It is odorless, has bitter and burning taste, followed by sensation of numbness. It is freely soluble in water and alcohol. Next is the stability and storage. It is oxidized by air in the presence of moisture. This reaction is catalyzed by metal ion. It is also affected in lice, hence it should be stored in tightly closed container which should be light resistance. Next is the suitable subsequent suitable. It is also used as the disodium EDTA as a stabilizer. Next is the uses. It used for the treatment of depressive disorders, anxiety state, phobic state, then chronic pain. It comes as tablet. Next is the cyclic amines and drug include transnial cyclopamine, cyclopropylamine derivative in which the phenyl radical is attached at two position. So this is a structure. Physical property, its sulfate salt is white crystalline powder. It is odorless and has cinnamon aldehyde-like odor and has an acidic taste. It is soluble in water and slightly soluble in alcohol. Its trans isomer is therapeutically active. Chemical property, when its suspension in alcohol is treated with ninhydrin, a purple color produced after 15 minutes. Storage, stored in well-closed container. It is used for the treatment of antidepressant. It is a MAO inhibitor used for the treatment of depressive disorder, anxiety, phobic state, obsessive disorder. Next is the formulation. It comes as tablet. Thank you. I hope this video is very informational for you.